I was working as part of my job at a mother-baby expo, and a couple came up to our hospital stall and they told me about their fostering, and I thought, well, gee whiz, if they can do it, they're older than I am, so can I.
I'm not a spontaneous person at all. I'm very organised. I like routine, I like structure, I like having my diary set up for months in advance. Emergency care is the opposite to that. So I've had to learn to be flexible and to answer my phone and take a call from LCC. They can ask us to have a baby in an hour or less. So we just have to work with that. Ready?
The fostering is a lifestyle, and you just do it. You've only got to do it once and you fall in love with it. What you can give to these kids, and I can only talk from birth to 6 months or 12 months, is something you can't put in writing, you can't put a dollar value on it. The rewards are insurmountable. It's just do it.
The babies come to us with no routine and often no belongings, and we work hard to get them into a routine and work out what they need and when they need it.
And it's very hard to get to know those babies in that 2 weeks, but you can see a change from a traumatised baby. It doesn't take long to get them used to being loved and held and fed and clean.
It feels like we put in all the sleepless nights and we put in all the hard work, but we also get the best bits too, because I feel like in emergency care, the babies come to you and they're ripped from everything that they know, and there's so much trauma behind that. So we see so much of the change, and so much we can be their safe people, and we can help them heal in that trauma that they've had.
I started fostering because as a young girl I was looked after by other people when my mother wasn't well, and then my parents were cottage parents in a group home. And the third reason, I guess, was because we were looking after our grandson at the time. We were bringing him up. I wanted him to know what other children needed and having other children in his life. And that has been the biggest reward, I guess, as far as looking at a 12-year-old boy be so compassionate and so loving with these kids. So that's why I foster.
It's basically because it's not about us. It's hard and exhausting, and sometimes you get your heart broken, but at the end of the day it's not about us. It's about these kids who need a family, and they need love, and they need to feel worth it, because they are. And as soon as they come into our home, they're loved and they're a member of our family, and they need that and they deserve that, and that's what keeps us going.
You've got to treat them as your own children, and you break your heart when you lose them, and you cry when they're suffering, and you're happy when they make achievements. You just got to do it. If your heart's not too big, you can't do it.